There's a new study on tobacco use in California, and the rest of the country has just been released. We don't want to get it lost in the midst of all of this COVID information. And I have to tell you, California is looking fairly decent. The American Lung Association just released its annual State of Tobacco Control study. Here's how California did. Funding for prevention programs, we got a B. Smoke-free air, solid A. State tobacco taxes, B. Here's a tough one. Access to services to quit tobacco, ouch, a C. And ending sales of flavored tobacco, a B. Here to discuss more about this is Erica Costa. She's Director of Advocacy for the American Lung Association here in our state of California. Nice to see you, darling. It's a big document. We got it. It was embargoed until now. We've had a chance to dig through it. And we just ran through sort of the good, bad, and the ugly. Let's start with the good of this B grade with the overall effort to deter tobacco use. We're doing okay here in the state.
Yes, we are. You know, California does well, and we received 1A, 3 Bs, and a C. So across the 5 categories, we have seen, good tobacco control laws in California, but we also have some room for some opportunity for growth here.
Absolutely. Just like your parents looking at your report card at home, there's areas for growth, and we'd like to see you improve in these areas. And one of those is speaking of report cards for kids, is our teens. You know, this next generation, there's concern about vaping leading them into and being, I hate to use it, but almost like being a gateway for smoking.
Yes, absolutely. We do have a vaping epidemic, and 1 in 5 teens are vaping. And what we often see is that they end up being longtime addicts of nicotine. And we really know that flavored tobacco products are the reason that so many young people begin vaping.
But again, there's, a lobby out there making sure that these efforts that you're trying to combat are meeting some resistance. This is a big challenge for you.
It is, and what we want to really emphasize is how important it is to pass comprehensive laws that prohibit the sale of flavored tobacco products. And this can really begin on the local level. And the gold standard of passing a local ordinance that prohibits the sale of flavored tobacco products really means not having any exemptions. That's the gold standard. No exemptions for menthol, no exemptions for certain types of tobacco products, but really ensuring that this is a comprehensive ordinance that protects public health.
And then so we had the good, we had the bad, now the ugly. The C grade that we got was in the area of coverage and access to services to quit. So basically you're saying in helping people and promoting the efforts to quit smoking, we're not doing well in California.
That is the area where we have really an opportunity for growth here. This particular category looks at the state Medicaid program. It looks at state employee health plans, looking at, do we have the proper medications? Do we have the counseling? Do we have the support available for people who are trying to quit? And our investment went down, in fact, from last year. We invested initially $3.26 per smoker, now down to $3.04. Now, this grade does fluctuate, and if you have a grade above an F, there's a little less wiggle room to move. But this is an area where we do want to be investing more to protect our public health.
Yeah, certainly. And let's talk about one of the areas that we see paralleling COVID is the fact that, much like COVID, tobacco use and secondhand smoke, which we should talk about as well, is, disproportionately affecting communities of color and lower income Americans and Californians.
Yes, absolutely. As a result of decades of targeting by big tobacco, including with flavored tobacco products, communities of color, underserved communities really have been targeted and are disproportionately harmed by tobacco-related death and disease. And we also know that as our nation faces COVID-19, smoking increases the risk of the most severe impacts of COVID-19. So preventing and reducing tobacco use is critical.
Let's talk really quickly about secondhand smoke. Tony and I were joking about it the other day because we were talking about how, because smoking isn't nearly as prevalent as it used to be, at least it seems, our noses are a little more attuned to it. You can tell if somebody's smoking even like 100 yards away. Talk about secondhand smoke and the reality of the dangers of that for a moment, if you will.
Absolutely. Secondhand smoke is a very, very dangerous and high cause of lung cancer. And also, what we're noticing is that as more people are staying home due to the pandemic, people are confined to their homes more in condos, in apartments, any kind of multi unit housing. And so it's really, really important to pass laws that really restrict that and really protect folks who are in their homes working from home during this pandemic.
Well, Erica, we are so grateful for you and the American Lung Association. We wanted to make sure this didn't get buried in all of the other COVID headlines. This is an important study. It's important for us to sort of do a check-in in our state and how we're doing. There is room for improvement, as they would have said on my report card with my math class in high school. Erica, thank you so much from the American Lung Association. Kudos for your work, and thanks for reporting in to us today.
Thank you so much.